Hello and welcome. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us. In this segment, we're going to be speaking with Aimee DeGolyer. She's joining us here as a C3 prize winner. The C3, or Changing Cancer Care Prize, funds and advances the best non-treatment ideas to improve cancer care for patients, caregivers, and the broader oncology community. Now, this year's grand prize winner, of course, is our guest this evening, founder and CEO of REPROSENT. She's going to receive $100,000 grant plus additional resources and hands-on support. She's going to talk a little bit about losing her dad in 2020 to a cancer immunotherapy adverse reaction, which inspired her to build a system that helps patients and their caregivers track symptoms data and triage challenging symptoms with a focus on reducing clinical team burden and improving outcomes. Welcome to Health Professional Radio, Aimee. Thank you for joining us this evening.
Thanks so much, Neil, for having me.
I told our listeners a bit about yourself. Tell us a little bit more, and then let's jump right into what inspired you to apply for the prize and your idea as well.
Sure. So I am a mom of three, live out in Los Gatos, California, and have been out here for about 20 years. And have been an entrepreneur for pretty much my entire career, and now have been leading REPROSENT for the last few years.
What was it that inspired you to start REPROSENT?
Well, as you noted, it does start with a sad story.
Mm-hmm.
I unfortunately lost my dad in the summer of 2020. It was due to a delayed adverse reaction to the immunotherapy treatment he was on as part of a trial for his pancreatic cancer. Mm-hmm. I think one of the hardest parts about this is that it was preventable. If he had known how important certain symptoms were, if he could have remembered or shared what was happening with his doctor, or if she could have seen what was happening, she could have intervened and we would have had more quality time that we desperately wanted. So really, the month after losing my dad, probably partially due to self-preservation, I put my head down and drove the vision for REPROSENT. It's essentially the system that we needed for him. And it's the system that so many more patients and their loved ones need to improve their quality of life, to keep them safe, and to help their doctors provide the best care.
So what is REPROSENT? What is the system? How does it work, and how does it help patients and caregivers as well?
At the highest level, what we're working on is, helping with the imbalance that exists in healthcare, where doctors have all of the knowledge, but very little time to be with their patients. And patients have a tremendous amount of time that they're on their own with no experience to know how to best care for themselves. I always, put it in context. There's 720 hours in a month, and you get less than one of those with your doctor. So we've really helped to direct those hours that a patient has to best help their medical team to drive success. What this means practically is we created an app where patients collect their symptom data in moments a day, essentially whatever they're experiencing, pain, nausea, fatigue, and they add these symptoms in a quantitative way to create a daily understanding of what's happening. We add their loved ones, a spouse or an adult child, whoever's helping them in their care, to expand that circle of care at home. We created a smart triage function so that if a patient enters in a concerning symptom, we ask them additional questions to find out if they might be in danger and tell them what action to take. And we tell their loved ones to go check on them to keep them safe. And then finally, before the appointment with their doctor, they meet with my oncology nurse staff. And together, they build a report that summarizes all the symptoms they've been tracking, how these symptoms are trending, and key questions that they need to get answered in the appointment. So that, it makes the appointment more efficient, more valuable. Really, in summary, we help patients collect their data. We increase their knowledge to keep them safe, and we make this new set of data actionable.
Are the caregivers, do they have to be trained in what symptoms to look for in the event that the patient can't enter them in themselves? Or maybe the caregiver understands a symptom and the patient doesn't or has forgotten that symptom is important?
Yeah, it's a great question. So one of the advantages we have with having two people on is caregivers can add observations that are unique to them. Things like, how the patient's appetite is, or, if they're getting as much activity as they normally do. But we very much limit to the patient the ability to add in things like their symptoms, how their pain is, things that only the patient can know. So we really rely on loved ones to help remind them to add these. We have alerts that go to the loved ones to help them know, but really have made this accessible and narrow to use so that a patient, even if they're bedridden, can add this in easily and in about 1.5 moments a day. And then I think the second question you asked there, does the loved one need to be trained? I think that's one of the beauties of this system, that by adding in the smart triage, really a patient doesn't have to remember, what a fever is or what, an early sign of sepsis or stroke could be, because when they enter the symptom information in, we help remind them and help educate them so that they have this expertise at home.
When you lost your dad and you went on this REPROSENT journey to develop this system, are adverse reactions in the way that it affected your father, is this something that is normal, widespread?
It actually is. So, when we're treating cancer, we have very blunt methods to treat it. You are burning it, you're cutting it out, you're poisoning it, and all of these things are fundamentally changing your body. And really, we don't know the impact that this will have on each individual's personal biology. And so, the extreme impact, they can range from nausea that makes you dehydrated, that makes you more susceptible to things like a stroke, infection, things that, while it's very obvious, I think, to health professionals, when you're someone who's never been sick before, and, this is a brand new experience for you, it's really hard to determine, is this a normal side effect from my chemo, or is this something dangerous? And so many patients wait too long before going in and, have to be admitted, have to go off treatment, and really make the, ability for the treatment to help them in the best way that much harder.
So how is this year's C3 prize that you've won, how's it going to help you with REPROSENT?
We are so honored to receive the C3 prize. These funds are really helping us to expand our product to more patients because, what's in front of us right now is we need to gather the clinical data and the economic data so that we can demonstrate our value and are able to scale to so many more patients that need this. So it's just really advancing the speed that we're able to do this. And I'd say additionally, the validation and recognition is very important to us, especially as we're raising funds to expand our team. We've been lucky to garner some interest and demand, but now we need to expand our team to be able to fill that.
What about any staffing challenges facing the industry, and how is REPROSENT going to help in that area?
Yeah, so, staffing challenges are everywhere, and it's so hard. I think, staffing challenges that are, in like the hospitality industry, it's annoying. When it's in the medical industry, it's, can be life-threatening.
Absolutely. And
I think it's challenging for patients. It's really challenging for the medical teams that are trying to hold the pieces together. In fact, we have patients on our platform that are given very long times to wait for varying appointments just because, there aren't enough staff like there used to be. I think what REPROSENT can really do is help harness the time that patients and their loved ones have to become an additional resource to the medical team. And what I mean by that is patients that have greater knowledge of when they need to be evaluated or hitting appropriate milestones reduces demands on the clinic. Planned reports with accurate data creates more efficient and effective visits. And patients that can take on a greater role in the continuity of what they're supposed to do next means a much more managed workflow. So I think it's just a bigger philosophy of how do we use the resources that we have at our disposal in the most effective way. And it's pushing some of that knowledge to the patient and their loved ones.
Well, once again, congratulations on your winning of this year's C3 prize. And do you have a website where our listeners can learn more?
We do. They can visit us at reprosent.com. That's REPROSENT.com.
Aimee, I appreciate your time this evening. Thank you so much for joining us here on Health Professional Radio.
Thanks so much, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Aimee DeGolyer, CEO of REPROSENT. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.